The biomechanical concept we will be addressing is equilibrium. Two components of equilibrium are stability and balance. Stability is defined as the resistance to the disruption of equilibrium. Balance is defined as the ability to control equilibrium. Equilibrium is being applied to this activity, being shown where the two women are throwing and catching a medicine ball. Each time the woman catches the medicine ball, she loses her balance. Therefore, the question we are answering is, how can we increase someone's stability?
So in order for someone to maintain equilibrium, you have to keep your center of mass within your base of support. And in anatomical position, usually in the human body, that's around, I think, sacral level 2 anteriorly, but that's always going to change because we're constantly in motion. So we have to adjust limb position and posture in order to maintain that center of mass within the base of support. And that's why a lot of times in elderly, we encourage a wider base of support because that's going to help improve stability and equilibrium.
Stability is affected by mass, friction, base of support, and center of mass location. Here, the woman does not have good equilibrium because she is wearing socks on hardwood floor, reducing her friction, her legs together and her feet touching, reducing her base of support, and she is standing with her knees locked, affecting her center of mass. Observations were made in the sagittal and frontal plane of her movement. Again, the question is, how can we increase someone's stability? The answer is by manipulating friction, base of support, and center of mass. Friction is a force that acts in the direction opposite to the motion or impending motion. It acts at the interface of surfaces in contact. As friction increases, so does the amount of force needed to initiate or maintain motion. Gloves are designed to increase the stability of a player's grip on the object they are holding or catching. The tread of an athlete's shoe is designed to increase the friction between the athlete's foot and the surface it is touching. Thus, if an individual puts on gloves and tennis shoes, they will increase their stability.
Center of mass is the point around which a body's mass is equally balanced in all directions. This concept determines the manner in which the body responds to forces. Center of mass has both horizontal and vertical components. Vertical positioning is more applicable to the problem we are trying to correct, so we will focus on this concept. If the center of mass is higher, then the system is less stable. A lower center of mass in the vertical position will make a system more stable. Thus, to increase her stability, the woman can bend her knees to lower her center of mass. Base of support is defined as the area enclosed by the outermost edges of the body in contact with the supporting surface. The more points of contact someone or an object has, the greater the base of support. The base of support and the center of mass have a very close relationship and often impact one another. The relationship between center of mass and base of support. If your center of mass were to move outside of your base of support, balance would be lost. This goes to show that the larger the base of support is, the less likely the center of mass is to fall outside of the base of support, which in turn makes a system more stable. Thus, if the woman increases her stance, she will increase her base of support and become more stable.
Center of mass, in terms of physics, is a unique point where the mass itself and the forces against it are all equal to zero. The center of mass moves in the direction of the net force placed on it. So in terms of an athlete in equilibrium, if that athlete is standing in one position and a force is applied to them, depending on where their center of mass is located and depending on how much force is applied, that athlete will move in that direction. So it's important for an athlete to have balance and equilibrium when it comes to forces applied externally or by themselves, even through movement.
Another way to manipulate someone's stability is to change their mass. However, this factor is more difficult to manipulate.
Okay, when I work on balance with a patient, I tell them there's 3 components of balance: the vestibular complex in your ears, joint receptors in each joint of your body, and your vision. So when we train balance, we take away one of those parts of the equation where we change one of them. So we may have their feet on a different surface with their feet close together, standing on one leg. I also remind them that your body goes where your head goes. So if you're looking down at the floor, you're more likely to tip forward. If you're looking up in the air, you're more likely to fall backwards. So we concentrate on where we're looking when we work on these exercises.
Here, the woman is demonstrating how altering your head's position affects your stability. When she tips her head forward, she begins to fall forward, and vice versa.
This individual was instructed to put shoes and gloves on to increase her friction. Through this anterior view, her stance was widened to increase her base of support. She also bent her knees to make her center of mass more stable in the vertical position. According to a study conducted by Hall in 1999, he showed that the ability to maintain equilibrium is increased by increasing body mass, increasing friction, increasing the size of a person's base of support in the direction of the external force, horizontally positioning the center of mass near the edge of the base of support of the oncoming external force by leaning into the force, and vertically positioning the center of mass as low as possible by crouching.
Okay, so the role of the arms is more than just interacting with our environment. It actually plays a part in our balance. So if someone has an injured arm and they, for example, their arm swing is altered when they walk, that in turn throws off how their hips are and can make them more prone to having a fall. And you also utilize your upper extremities to help you to keep your balance if you are in the process of falling.
The woman is demonstrating how changing arm position affects your center of mass location, which affects your stability.
So the center of mass is synonymous with your center of gravity. So what that means is if you have an external force applied to you, your center of mass is the point where if that force hits you, it's going to move in that same direction, but not rotating.
This concept can also be applied in future for intervention in rehabilitation settings or even in sports. Equilibrium plays a huge role in everyday activities along with sports. Health professionals could incorporate these 4 components of stability in therapy and training to help decrease falls and injury.